Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Drugs used for angle closure glaucoma. In angle closure glaucoma, we use drugs like hypertonic mannitol is given 20% hypertonic mannitol in the dosage of 1.5 to 2 gram per kg, or we can also give glycerol in the dosage of 10% is infused IV. This will decongest the eye by osmotic action, and thus um, this will decrease the intraocular tension. We can also give acetazolamide can also be given in the dosage of 0.5 grams intravenously, followed by orally. You can give twice daily to be started concurrently. Then we can also give myotics. Myotics are once the intraocular pressure starts to decrease due to the with the help of this mannitol and acetazolamide, both these will decrease the intraocular pressure. Once the intraocular pressure has started to decrease, then you can start this myotic, which is pilocarpine is given in the dosage of 1 to 4%, is instilled every 10 minutes initially and then at longer intervals. So this pilocarpine will cause contraction of sphincter pupillae, thus changes the direction of forces of the iris and loses the contract of lens, and hence the iris mass. And hence if you see, this is the iris and this is the lens. So as a result, the iris will move away from the lens, and thus the pupillary block which is produced is removed with the help of this myotics. And iridocorneal angle, because this will move up and this block is removed, the iridocorneal angle will also be freed. So however, when intraocular tension is very high, if intraocular pressure is very high, then this pilocarpine does not respond. So we should give pilocarpine only and only when the intraocular pressure becomes normal. Then we have topical beta blockers are also given, like timolol can be given, and we have apraclonidine can be given, or latanoprost can be given. But for angle closure glaucoma, the definitive treatment or treatment of choice is to do a laser iridotomy is done.
thank you and thank you for watching.